Welcome, dear friends. Today we are going to learn about posology. After studying this video, the students shall be able to learn the definition of posology and they can learn what are the different factors which affect posology. Now, what is exactly posology? Posology is derived from a Greek word which means posos means how much and logos means the science. So we can say posology is the science of how much. Okay, so posology is a branch of medical science which deals with dose or quantity of the drugs which can be administered to a patient to get the desired pharmacological action. The dose of a drug cannot be fixed rigidly because there are so many factors which influence the doses. These factors are age, condition of the patient, severity of the disease, tolerances, both natural and acquired, idiosyncrasy, route of administration, formulation which is used, drug interactions, and rate of elimination. Now, let us see the factors which influence the dose. The optimum dose of a drug which produces the desired therapeutic effect it varies from person to person because every individual it varies both the degree and character of the response produced by the drug. Due to this reason, the doses of official preparations of the drugs are expressed in the form of a range which gives the therapeutic effect. The dose range is usually based on the average requirement of an adult patient. The first factor is the age. The pharmacokinetics of many drugs it changes with age. So while determining the dose of the drug, the age of the individual is of great significance. Children and old people they need lesser amount of drug than the normal adult dose because they are unable to excrete drugs to that extent as adults. So we can say the organs which are involved in the excretion or metabolism they are not so developed in the children and they are not so functioning in the adults, I mean the old age people. Okay, so that's why the dose required is less. Children can tolerate relatively larger amounts of belladonna, digitalis, and ethanol, whereas elderly patients they are more sensitive to some drug effects like hypnotics and tranquilizers, which may produce confusion state in them. The next factor is sex. Women they do not always respond to the action of drugs in the same manner as it is done in men. Morphine and barbiturates may produce more excitement before sedation in women. Special care should be taken when drugs are administered during menstruation, pregnancy, and lactation because you cannot give the drugs which can cause cramping in the stomach during menstruation or during pregnancy, or you cannot give the drugs which have a tendency to leak out with the milk when the female is feeding. Also, during pregnancy you have to see that the drug it should not be teratogenic, means it should not affect the fetus. You cannot give strong purgatives during menstruation or pregnancy. Similarly, the drugs which may stimulate the uterine smooth muscle, that is drastic purgatives, anti-malarial drugs, and ergot alkaloids are contraindicated during pregnancy. There are certain drugs which on administration to the mother are capable of crossing the placenta and affecting the fetus. These mostly includes alcohol, barbiturates, narcotic and non-narcotic analgesics, etc. During lactation, the drugs like antihistamines, morphine, and tetracycline can can be excreted in the milk. So you should not give this medication to a lactating woman. The next factor is body weight. The average dose is mentioned either in terms of milligram per kg weight or as a total single dose for an adult weighing between 50 to 100 kg. However, the dose it is expressed in this fashion, it may not apply in case of obese patients, children, and malnourished patient. So it has to be calculated according to the weight of the patient. Next is route of administration. Intravenous doses of drugs they are usually smaller than the oral doses because the drugs administered intravenously enter the bloodstream directly. Due to this reason, the onset of drug action is quick with intravenous route, and this might enhance the chance of drug toxicity. The effectiveness is controlled by the route of administration. Next factor is time of administration. The presence of food in the stomach, it delays the absorption of the drugs. The drugs are more rapidly absorbed from the empty stomach. So the amount of drug which is very effective when taken before a meal may not be that much effective when taken during or after meals. The irritating drugs, they are better tolerated if administered after meals, like iron, arsenic, and cod liver oil. They always have to be given after meals. Daylight is stimulant and it enhances the effect of stimulating drugs and diminish the effect of hypnotics. So the next factor is environmental factors. We can say darkness is sedative. Hypnotics, they are more effective at night, and sedatives, they are not so effective during the daylight. The amount of barbiturate required to produce sleep during daytime is much higher than the dose required to produce sleep at night. Alcohol is better tolerated in cold environments than in summer. The next factor is emotional factors. The personality and the behavior of physician may influence the effect of drug, especially the drugs which are intended for use in a psychosomatic disorder. The females, they are more emotional than males and hence they require less amount of drug. Insert insert dosage forms called as placebos, inert dosage forms which are known as placebos resemble the actual medicament in the physical properties, are known to produce therapeutic benefit in diseases like angina bronchi, angina pectoris, and bronchial asthma. The next factor is presence of disease. Drugs like barbiturates and chlorpromazine may produce unusually prolonged effect in patients having liver cirrhosis. Streptomycin is excreted mainly by the kidney and it may prove toxic if the kidney of the patient is not working properly. During fever, a patient can tolerate high doses of antipyretics than a normal person. The next factor is accumulation. The drugs which are slowly excreted, they may build up a sufficient high concentration in the body and produce toxic symptoms if it is repeatedly administered for a long time. Example is digitalis, emetine, and heavy metals. These occurs due to accumulative effect of the drug. The cumulative effects are usually produced by slow excretion, degradation, and rapid absorption of the drugs. Sometimes a cumulative effect is desired in drugs like phenobarbital in the treatment of epilepsy. The next factor is additive effect. When the total pharmacological action of two or more drugs administered together is equivalent to some of their individual pharmacological action, this particular phenomena is known as additive effect. For example, combination of ephedrine and aminophylline in the treatment of bronchial asthma increases the altogether effect of ephedrine and aminophylline. The next factor is synergism. When we use two or more drugs in combination, their action is increased. This phenomena is called as synergism. Synergism is very useful when desired therapeutic result needed is difficult to achieve with a single drug. Example is procaine and adrenaline combination increases the duration of action of procaine. Next factor is antagonism. When the action of one drug is opposed by other drug on the same physiological system, this is known as drug antagonism. The use of antagonistic responses to drugs is valuable in the treatment of poisoning. Example is milk of magnesia is given in acid poisoning, where alkaline effect of the milk of magnesia neutralizes the effect of acid poisoning. When adrenaline and acetylcholine they are given together, they neutralize the effect of each other due to antagonism, because adrenaline is vasoconstrictor and acetylcholine is vasodilator. The next factor is idiosyncrasy. An extraordinary response to a drug which is different from its characteristic pharmacological action is known as idiosyncrasy. The word it has replaced by the term called as drug allergy. For example, a small quantity of aspirin may cause gastric hemorrhage, and a small dose of quinine may produce ringing in the ears. Some persons are sensitive to penicillin and sulfonamide because they produce severe toxic symptoms. The next factor is tolerance. When an unusually large dose of a drug is required to elicit an effect ordinarily produced by the normal therapeutic dose of the drug, this phenomenon is termed as drug tolerance. Example is smokers can tolerate nicotine, alcoholic can tolerate large quantity of alcohol. The drug tolerance is of two types: true tolerance, which is produced by oral and parenteral administration of the drug, and the second type is pseudo tolerance, which is produced only to the oral route of administration. The next factor is tachyphylaxis. It is observed that when certain drugs they are administered repeatedly at short intervals, the receptors they get blocked up and pharmacological response to that particular drug is decreased. The decreased response cannot be reversed by increasing the dose, and this particular phenomena is known as tachyphylaxis or acute tolerance. Example is when ephedrine is given in repeated doses at short intervals in the treatment of bronchial asthma, it might produce very less response due to tachyphylaxis. Similarly, the drugs like amphetamine, cocaine, and nitrates behave in the same way. The next factor is metabolic disturbances. Changes in water electrolyte balance and acid base balance, body temperature, and other physiological factors may modify the effect of the drugs. Salicylates reduce body temperature only in case the individual has rise in the body temperature. They have no antipyretic effect if the body temperature is normal. The absorption of iron from GIT is maximum if the individual has an iron deficiency anemia. So this was all about factors affecting posology. Thank you for listening.